Hi, my name is Dr. Rudra Mohan and through the Oral Health channel, today we're going to be talking about what are the harmful effects or the effects of vaping on the oral health. Let's start. So I'm going to make an episode today where I'll be talking about in detail what are the harmful effects of e-cigarettes and or vapes on oral health. So we all know the harmful effects of smoking and smokeless tobacco on the oral health and the overall health and other aspects of your general health. However, in 2003, from the period of 2003 to 2006, a new trend had started about something that was a newer material in the market, which was known as electronic nicotine delivery systems, or basically e-cigarettes or electronic cigarettes, and also vapes. Now the basic difference between an electronic cigarette and a vape is usually an electronic cigarette has nicotine and a vape might or might not have nicotine in it. A lot of people, I've recently been contacted by some patients, especially internationally, who have told me about the fact that they are vaping and they have developed some sort of lesions in their mouth and they are undergoing a lot of problems. So that's why I thought I should go back to the books and try to read as much as possible about any possible effects or harmful effects of vaping on oral health. So basically, electronic cigarettes or vapes have an atomizer liquid, and basically with the help of a heating coil which is charged by a battery, and basically it converts the liquid into aerosol which goes inside your lungs and then you exhale it as smoke. That's what the mechanism is. Now coming to stuff like formaldehyde, which is hidden, which is much more in vapes compared to conventional cigarettes, and this goes and gets very efficiently deposited in your lungs. Formaldehyde is actually a very potent carcinogen. I agree that the number of carcinogens present in conventional cigarettes, about 72, is much more than what are present in vapes, but then again we don't have any long-term studies because of the fact that there are other chemicals in vapes which are basically your diacetyl, carbonyl, nicotine, and all those things which can cause a lot of dysplastic changes. That means they can cause cell damage or oxidative damage or DNA damage to your cells in the long term, depending upon your intensity, frequency and duration and the chronicity of the exposure of the vape. Now you have to understand this, that despite the fact that all the studies that I've done, the basic symptoms that most of the people who are chronically vaping is basically dry mouth, burning sensation, soreness in the mouth, tonsillitis, uveitis, laryngitis, nicotine stomatitis, hairy tongue, and sometimes you might get we don't know yet about the carcinogenic potential because all the studies have been done in vitro. That means they've been done out of the body in terms of tissue culture and all those things. Now it causes whatever the thing is, because a lot of people have this misnomer. I understand most of the effects are much less compared to conventional cigarettes, but they are still much more to a person who is a non-smoker or a non-vapor. You have to understand that. That's very important. Secondly, there has been found that there is more tooth loss, more periodontal damage, more inflammation, periodontal inflammation that is seen in vapors compared to non-smokers or non-vape users. And secondly, you have to understand that peri-implant diseases, that means diseases around the implants, implant failures, any type of bone loss around implants, is also considered to be more in vape users compared to your people who don't smoke. Now this might be a little different or lesser than conventional smokers, but let me tell you something very importantly. It might be a safer alternative for conventional cigarettes, but it is not a safe alternative. Let me bring my words as slow as possible to enunciate. It might be a safer alternative, but it is not a safe alternative. That means you should try and avoid doing it as much as possible. You should try going cold turkey. You should try tapering it down and then going completely teetotaler when it comes to smoking. Secondly, it has a lot of other effects. It has been found that it produces a lot of dry mouth. It also causes a sense of the more caries are seen in patients who chronically vape. And on top of that, it has found that it gives you bad breath. So despite the fact this concept has been relatively new, you have to understand that electronic cigarettes or vapes are still harmful compared to not doing it at all. Try for nicotine replacement therapies, meditations, fitness. Try to distract yourself, try to keep yourself busy, try to eat right, and try to make sure that you can quit this habit as much as possible. So in conclusion, I would like to tell you that if you can quit this habit, that is vaping, please try to do so, because even if it's not as harmful as conventional smoking, it is bad for your oral health and overall health. So that's it for today's episode. Please like, share and subscribe, and do press the bell icon for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number. Just drop me a message with your name, your place and your common oral health problem, and I'll get back to you within a couple of days. So that's it for today. Thank you.